stroke or brain attack is a sudden loss of brain function caused by disruption of blood supply to a part of the brain, which results in infarction or death of brain tissue. Time is a brain. About 2 million brain cells die every minute during a stroke. Rapid assessment, diagnosis, and treatment are crucial to save brain tissue and improve the patient outcome. Upon arrival at the emergency department, the triage nurse assesses for a potential stroke using the FAST screen, with F for facial asymmetry, A for arm or leg weakness, S for speech disturbance, and T for time of symptom onset. Once code stroke is activated, a specialized team assembles to quickly assist the patient for suitability for intravenous thrombolysis using a clot-dissolving drug called tissue plasminogen activator, or TPA, which can be given within 4.5 hours of symptom onset. The nursing staff assist the vital signs, secure 2 large bore IV lines, measure the blood glucose level, and draw the lab work.
Assalamu alaikum. What do we have here?
The stroke physician obtains a brief, relevant history from the paramedics and the patient or their family member.
How are you doing?
Then a focused examination is carried out using the NIH stroke scale to assess different aspects of the patient's brain function, including level of consciousness, gaze, visual fields, motor function, coordination, sensation, language, and speech.
Okay, here and here. Very good. I'll just take your mask for a second. Can you show me a big smile? Okay, very good. Very good. Now the left leg. Try your best. Touch your nose. Touch my finger. Good. Can you touch your nose? Wow. Okay. Oh, can you tell me what's going on in this picture, please?
The NIH stroke scale is a standardized assessment tool to quantify the severity of stroke. The patient is then taken to the CT scanner for an emergency CT scan of the head without contrast. CT images are instantly reviewed to rule out hemorrhage or a brain tumor and evaluate for early signs of ischemic stroke. The stroke physician explains the diagnosis of acute ischemic stroke to the patient and their family and goes over the TPA criteria checklist to assess for any contraindications. The benefit and risk of TPA therapy are thoroughly explained. Once an informed consent is obtained, the stroke nurse starts mixing the TPA. Two licensed staff calculate and validate the TPA dose based on the patient's weight. Ten 10% of the calculated TPA dose is given as a bolus over 1 minute. The rest is given as an infusion over 60 minutes. After initiating the TPA infusion, CT angiogram of the head and neck is done to evaluate for extracranial or intracranial large vessel occlusion. If a large vessel occlusion is detected, the patient is rushed to the angio suite for endovascular therapy in the form of mechanical thrombectomy. The time window for endovascular therapy is 6 hours from symptom onset. If no large vessel occlusion is found on CT angiogram, the patient is transferred back to the ED room, where the TPA infusion is continued. In the meantime, the patient is monitored constantly with frequent vital signs measurements and serial neurological assessments. The patient is then admitted to the acute stroke unit for further workup and management. The following target times are implemented to ensure the timeliness of TPA delivery in hyperacute stroke cases. Stroke team arrival within 10 minutes of code stroke activation. CT scan performed within 25 minutes. CT interpretation within 45 minutes. TPA delivery within 60 minutes, which is called the golden hour. Remember, time is brain, so act fast. Stroke is not only preventable, but also treatable.